My name is Asante Hilts, and I'm the Chief Executive Officer for Valley Healthcare System Incorporated. Access to healthcare continues to be a problem in our community, so people are not always able to get to us. The partnership that we have with Enrichment Services allows us to bring services to where people are. Children and families are already coming to utilize the Enrichment Services program and their services, so we bring those health, those medical, those dental, behavioral health services to the Enrichment Services facilities and sites, and that eliminates that barrier of access for the families. We are a community health center, also known as a federally qualified health center, and our mission is to serve the community providing comprehensive health care, and that includes family practice, pediatrics, dentistry, vision health, pharmacy, and behavioral health, as well as outreach services like transportation. I was inspired to be involved in this type of work because I was a recipient of a community health center growing up. I lived in a community where the only opportunity that I had to access healthcare was at a community health center. So I then became a public health practitioner, understanding that there's a lot of things that determine a person's health. Their access to healthcare, providers who they can access, as well as being able to serve people regardless of their ability or inability to pay. So my inspiration is knowing that I come from a place where I relied on community health centers, and I know there's still a lot of other people who need these services. The great thing about the partnership between Valley Healthcare and Enrichment Services is that we're not just in Columbus, we serve the whole region. And one of the things that makes us unique as an agency is that we accept Alabama Medicaid for our families. So our families who live on the Alabama side of the region can come and access the same services that our families in Columbus can. So we're not limited just to Columbus, but all those rural communities, as well as our families in Alabama, we want to service them all. So we accept all insurance types, and we can service a family even if they're uninsured. And we'll help them with the wraparound services, get them enrolled in insurance, provide transportation if they're needed. So the goal is to remove all barriers to healthcare for our Enrichment Services family and our community at large. Valley Healthcare System has been a part of the Vaccine Equity Program that's out of Enrichment Services, and that allows us to provide vaccines to rural communities who otherwise will have no access to immunizations. That includes COVID shots, flu shots, and through that partnership, we're able to complete our mission, which is to bring health services to our most rural communities. The next goal for our agency is to think outside the box about healthcare. And one of the strategies that we're using to accomplish that is our OnMed Care Station. It's a health pod that allows us to utilize telehealth services so that we can serve our families outside of traditional hours. They can come to see us with no appointment necessary, to see a provider on the screen and utilize advanced technology, pulse ox, blood pressure, screening of the eyes and the skin, and get all those things done without having a provider physically in front of them, but seeing someone using telehealth technology. That's going to open the door for us to walk into the future with the new generation who's accustomed to doing everything via telehealth online, and we don't want to be left behind. So we want to be able to service Enrichment Services families as well as any family in this community with the technology that's cutting edge. My advice to other organizations would be to not operate in a silo. Don't stand alone on an island, but lock hands and join forces in partnership with other organizations like Enrichment Services so that we can have a larger and lasting impact for the same community that we're all trying to serve.